It's a peer education group that tries to put young people's thoughts towards issues which are relevant to them forward. We've done several events, our most recent ones being a youth health event, which is a huge festival, and all of the young people of East Renfrewshire have been invited to it, and they've been asked to let us know about the health issues that matter the most to them, and that's how we developed our peer education patch, which is based on healthy weight, tobacco, alcohol, and sexual health.
The biggest thing that really impresses me is they're so eager to help out and so eager to put their message across. They're very articulate and much more confident than I am. Like, they can stand up in front of conferences and speak to hundreds of people, whereas I would be a bit more shaky about that. So they're very confident, and I think that's just an amazing trait to have. And not every young person has the confidence to stand up in front of hundreds of people and talk to like heads of services and put their message across, which is, I just think is very impressive.
It's mostly around how the influences of tobacco and how advertising can influence young people into buying tobacco, and also the long and short term effects of tobacco. Due to the money from the Crofton Award, we're currently working with a group called, well, not a group, a school, Isabel Mayer, and we're developing a peer education pack for people with additional support needs. And we're collaborating with them, and we also have people who are experienced with working with people with additional support needs, and hopefully we'll be releasing that to the public, and with the help of the Crofton Award, we'll hopefully go far.
The work we were doing with kind of Isabel Mayer at the moment, we're trying to just get off and started, because obviously we won the £1,000 for the Crofton Awards, which was amazing, and that will hopefully go towards building some sort of tobacco resource for additional support needs. So we're just trying to work that out at the moment, and that'll be quite a big project to do, because it's for additional support needs, so we need something that's very interactive. So trying to get the things together based on kind of Ash Scotland or knowledge and resources, putting that all together is going to be a big task. Also, we've got new recruits, so putting them through the peer education, the training, so just creating more kind of training outcomes and stuff for the young people.
I was surprised at the fact that shisha is so bad for you, it's equivalent to 10 cigarettes. I thought it had no bad effects.
I think the stuff around the shisha again was actually very interesting, because I'm aware, like in Glasgow where I'm from, there is the kind of shisha culture at the moment, so it's been very interesting learning about actually shisha is dangerous, and the different things that's actually in the shisha and how it works. I thought it was really interesting.
I think it would be good for people that are just being introduced to smoking, but sometimes I feel as if it won't affect long time smokers. But then it could put them off if they've got an unattractive thing in their hand.
I wasn't quite aware of how strict the rules were in Scotland about advertising, and I didn't realise that it was 1965, was it, where things started happening. So I think that was quite impressive, and that's a big high five for Scotland, considering we do have quite a lot of high rates of things like crime and stuff like that. I think it is really impressive that we've taken that step forward for tobacco.
Obviously, it's your choice about tobacco, but don't fall into the huge trap about it looking cool and fashionable. Know what you're getting into first before you fall into the big bad trap of addiction.